It's 6 o'clock on Monday, the 5th of October. Good morning. This is Today with Justin Webb and Martha Carney.
7 minutes to 9. Life is about risk. And of course, nowhere is that more salient in our minds than with COVID-19. And we promised earlier in the programme that we would put some of your thoughts and questions about balancing all of these risks to an expert. And we can do that now. Professor Tom Solomon is Director of the UK's Emerging Infections Research Unit at the University of Liverpool and is on the line. Morning to you, Professor.
Good morning.
Let's get straight to some of the questions. We've got two here, one from Philip Tucker, one from Tim Clark. So Philip Tucker says, my question for the professor is about touching newspapers and mail. Are such surfaces dangerous? And Tim Clark adds that he read in an article yesterday, I think it was in the Sunday Times, that the evidence of getting infected from surfaces, any surfaces, was low. Is that correct? What's your view?
Well, I think for all of these questions, like you said, it's about risk. So I'll just give some preamble, which I think applies to every question we're talking about. The first thing is that the risk depends on how much virus there is circulating in the community at the time. Now, we know that at the moment in some areas it's about 300 per 100,000 people, so 1 in 333 people. So that's important to bear in mind because that will impact on all the answers. And then the other thing to bear in mind is it depends on your personal circumstances. So if you're elderly, frail and have known risk factors for severe COVID-19, then you're going to think about things differently to if you're a teenager in whom we know the chances of getting severe disease are low. So to come on to this particular question about newspapers and surfaces, to begin with, we thought that surfaces were the main means of transmission of the virus. We now know that droplet spread, respiratory spread is more important than we initially thought, which is why face masks have become more important. But that doesn't mean surfaces are now completely free of risk. And when it comes to things like newspapers and mail, the chances of the newspaper that's passed into you through the door by the person delivering it carrying virus is pretty low. And to begin with, the WHO said they thought the chance of newspaper paper supporting virus was low. So all in all, it's a low risk. But if somebody is shielding and they themselves, have severe illness, then they might consider things like wearing gloves when they are opening the mail. And then once they've dealt with all the mail, throwing the gloves away and washing their hands.
Okay.
I know one person who's at severe risk who actually puts the newspaper in the Arga every morning for 10 minutes. Right. So it's heated.
And you're telling them, you're not telling them that that's crazy. You're saying go ahead and do that.
It depends on your personal risk and your personal feeling about risk as well.
Right. Heidi Orrell asks, what do we know about how long the virus stays in the air? How safe is it to be in an indoor space, even if you're 2 meters apart?
Well, there's a range of data on this suggesting slightly different things, but all in all, a recent study showed that droplet aerosol, so a fine mist, creating virus, the virus could be surviving for several hours. 3 or 4 hours, something like that. Clearly, the risk is less if you're outside because it's being blown away.
And obviously less if you ventilate inside as well.
That's right. So if there's good airflow or if you're in somewhere with the windows open, that's better. Some of the ventilation systems actually just recirculate the same virus. So that's not so helpful. Right. And again, it depends in terms of being inside. It depends how many people there are in that space, because the more people there are, the more likely it is to survive. Also, if it's a moist, cold environment, the virus is more likely to survive, which is why meat packing factories seem to be a particular risk.
Helen Biggs contacts us. I suspect there are a lot of people in this situation with dental appointments coming up, been in pain. Poor Helen Biggs is getting worse, she says. How safe is the dentist? At one stage, the WHO was saying they thought people should avoid routine dental appointments. Clearly, if somebody is in pain from a tooth problem, they need to see a dentist. And the dentists are putting a lot of effort into making sure it's as safe as possible. So any dentist with any symptoms at all would not go in and perform their practice unless they've been tested. But also, they're doing a lot to make sure that the risk of transmission, both from the dentist to the patient and the other way around, is minimised. Yeah. Emma Green writes, 2 children at school, 1 primary, 1 secondary, a 90-year-old mother who lives at the other end of the country. Should we all go and visit her at half term as we usually do, worried about the children unknowingly infecting her? I mean, again, it's a balance here, isn't it? Because, my goodness, the pain of not doing it is huge as well for lots of people. That's right. It's a balance. But the things that, if you are going to do that, the things that will make it safer are, first of all, obviously not doing it if the kids are at all unwell, or if maybe someone in one of the kids' classes has been unwell, because then maybe your child has virus and doesn't know about it. And then if you're visiting grandma, try and visit her, stay outside. Don't stay in a hotel. And when you go and see her, stay in the garden. Or if you're going into the house, keep the windows open.
Yeah, but you can go, but just don't go close. That's really the answer, isn't it? If you can bear
depending on where you're from. If you're in Merseyside at the moment, you can't go because we're not allowed to travel at all, because our risk is more than...
less about the rules and more about people's personal decisions, which I think is it's part of the direction we're going in, really.
Yeah, for some 90-year-olds, it would be, it would be awful for them not to see their grandchildren for 6 months or a year. And so it's about balancing risk.
Paul Marsden writes, if 4 people meet for an hour, they keep social distance, they're outside, what is the risk of contracting COVID-19 compared to the same situation but inside?
It's much smaller outside. We know that for sure. And that's why, as far as possible, people are encouraged to meet outside.
Yeah. Graham Stickings, I've heard experts say viruses over time will mutate to be more contagious but less lethal. Is that happening?
Well, the virus is changing, but viruses always change. Their nucleotides, their nucleic acid changes over time. And there are slightly conflicting data about the current situation. But if anything, you think about the 4 coronaviruses that we already have that circulate every year and cause coughs and colds. They probably caused more severe disease when they first arrived, and they've generally drifted to cause milder disease over time.
Okay. Professor Tom Solomon, thank you so much. Sorry if we didn't get to your question. We will do this again.